Yesterday, Iowa Governor Kim Reynolds announced that her state's public health disaster emergency proclamation will expire at 11:59 p.m. on Tuesday, February 15th. In a statement, the Republican governor wrote, quote, "We cannot continue to suspend duly enacted laws and treat COVID-19 as a public health emergency indefinitely. After 2 years, it's no longer feasible or necessary. The flu and other infectious illnesses are part of our everyday lives, and the coronavirus can be managed similarly. State agencies will now manage COVID-19 as part of the normal daily business," end quote. This is similar to what Senate Republican leader Mitch McConnell said on the floor of the Senate.
It's time for the state of emergency to wind down. But disturbingly, whether or not we should trust the science and reclaim normalcy is somehow becoming a partisan question.
Other European countries have taken this advice. Most notably, Scandinavian countries have moved to relax COVID regulations, following in the footsteps of Denmark. Is it finally time to begin moving on, or is it too early? Here with me now to talk about this is Dr. Andrew Bostom. He's an academic clinical trialist and epidemiologist who's currently a research physician at the Brown University Center for Primary Care and Prevention at Kent Memorial Hospital in Rhode Island. Dr. Bostom, welcome back to the program.
Thanks for having me on.
So you heard the news about the Iowa governor. Is this the right call? Should
Absolutely.
we be declaring
Absolutely.
this over?
And it was a very clear and accurate statement. You know, where there's an important ratio measure. It's called the infection fatality ratio. So it looks at the entire gamut of infections, from severe infections that cause hospitalization, even ICU hospitalization, to infections that are 100% asymptomatic. A person literally wouldn't know that they were infected other than maybe eventually having a positive antibody test. And if you look at that ratio, and then unfortunately on top of that, you know, the numerator for that are the actual deaths from the disease. And so now with Omicron, it's been calculated in the UK, which has basically run through its course of the Omicron wave, that the infection fatality ratio is down to 0.06%, which is 6 in 10,000. That's actually half of what the 2017-18 seasonal flu infection fatality ratio is, as calculated by our own CDC. So we are really reaching an endemic phase where this is, at least in terms of Omicron, I mean, we can only say where we are now. We're at a phase where this is truly a sort of moderate, you know, flu equivalent, you know, not even a severe flu outbreak. So it's absolutely appropriate.
Now, we also mentioned there are several European nations who are taking similar steps, many of them in Scandinavia, Sweden, Norway, Denmark, taking similar steps. Even France is taking moves to loosen restrictions. How different is the health data across the globe, or do developments in these countries signal that we could see this very quickly in other countries?
Well, you know, we're getting a hint of the exaggeration in this country when, you know, we're starting to see what's so-called incidental hospitalizations reported, and the numbers are staggering. I mean, again, certainly during this Omicron wave, and while it might not have been
Dr.
to this
Bostom?
extent, yes.
Very quickly, can you explain what an incidental hospitalization is?
Oh, I'm sorry. I'm a little long-winded. I was about to get to it. So it means that someone's admitted with a positive test. They test positive in the hospital. Often they're not even coming with a respiratory complaint. They may have been coming for surgery, for trauma. They have a serious medical admission that has nothing to do with COVID, but they test positive. And because they test positive, and because certain PPE requirements are now called into place, they're lumped together with people that come in with a respiratory syndrome, with a pneumonia, with at least some upper airway, symptoms that drives them into the hospital. And across the country, we're seeing rates of this kind of quote unquote incidental admission at 50% or higher. The Jackson Health System, which is the flagship hospital for the Miami area, has been tracking for the entire, I would say since around Christmas. And what they're up to about, first of all, the good thing is that their total hospitalizations related to COVID have come down dramatically, signaling again that we're past the peak of the wave and it's rapidly receding from Omicron. But they're running about 60% incidental hospitalizations now. The state of Massachusetts, in my neck of the woods, is reporting about 50% incidental hospitalizations. This is a widespread phenomenon, and what's important is that this will translate, unfortunately, into an exaggeration of mortality, because once there's a designation, any death with a positive test, according to the CDC, can be classified and often will be classified as a COVID death for other purposes, reimbursement purposes, for example.
Yeah. Dr. Bostom, we got about a minute left. What numbers should the government be looking at to declare this over? And do you have any idea of what numbers they are looking at to determine whether they will move on from the COVID restrictions?
Yeah, I mean, typically you would be looking at hard metrics like hospitalizations. Again, if we could cut through to the chase and get through these incidental hospitalizations and focus on true respiratory syndrome hospitalizations and true respiratory syndrome deaths from COVID, I think we'll be there very quickly with the way that the Omicron wave is plummeting. And again, the data that we have from countries that were got the Omicron wave a little bit earlier is convincing. They're literally dropping their restrictions, and we should be there shortly.
We certainly hope that we are there shortly. However we felt about what's happened in the past, I think everybody's ready to move on. Dr. Bostom, thank you so much for your time.
Thank you very much.